Hi, I'm Kara. I'm one of the CVTs here at DLEAH, and this is Penny. And today we're going to learn how to express anal glands in a dog. But before we learn how, we're going to learn why. So essentially dogs have two anal sacs, or they're called anal glands more commonly, and they lay just inside of the anus. And typically when dogs defecate, they will express these anal glands and it releases this really foul-smelling liquid, but it's a way that they communicate with each other. So it's kind of why dogs are always sniffing each other's rear ends, sniffing each other's feces. So it's a really normal thing for these guys to do, but sometimes they get issues where they can't express them normally. So some of these things that can happen, some dogs just anatomy-wise, their anal glands don't express pretty easily, so they have trouble. Other times when we have overweight dogs like Penny, especially small breed overweight dogs, they tend to have more issues expressing their anal glands normally. And also if there's any changes in stool consistency, so typically they need nice, normal, firm stool to express them, but if we're having chronic diarrhea, chronic soft stool, that can also cause some issues where those glands are not expressing fully or at all, so they may need us to come help them out with that. When that happens, you'll see some changes in your dog. Most often you'll see them sort of scooting their rear end across the ground. Sometimes they'll pay a lot of attention to the rear end. You'll see a lot of licking, a lot of biting. You can also see some oozing as well. When they're not trying to defecate, some of that liquid might come out a little bit. So when we see those signs, that's a good indication that we might need to express these manually. And we're going to demonstrate how to do that. All right, so we're going to demonstrate how to express Penny's anal glands now. I have our TA assistant, Evan, here to help me. So this is always a two-person job. It can be a little uncomfortable. I'm sure you've seen this when you're taking rectal temperatures or when doctors are doing rectal exams. It can be mildly uncomfortable, so we do want to have someone here to help hold the dog and make sure we're all nice and safe. But we do have some supplies here that we'll need. So you do want to wear gloves, always. We need lubricant. You need some sort of material to catch the anal gland substance. So I'm going to use gauze today. You can use paper towels, a towel. We'll also need something to clean the dog up after with. So we use waterless shampoo here at DLEAH. You can use baby wipes, anything like that. But it is important that we are cleaning up these dogs before we're sending them home to owners. The anal gland substance is really pungent. It's got a pretty fishy odor, so we should be cleaning them up before we're sending them home. So I've got some towels and some waterless shampoo for that. So we're going to get Penny ready. So I'm actually going to switch places with Evan. The ideal position to have this happen is to have the dog standing. You can do them in sternal or lateral, but standing is the easiest. It gives you the most access to the rear end and is easier to express this way. Evan's doing a great job of holding her, so we want to keep her rear end nice and high so it's easier for the person expressing them. If she tries to sit down, that's not ideal. But he's also making sure that she's securing her head. Like I said, it can be mildly uncomfortable, so we just want to keep everyone nice and safe. So he's going to make sure that she's nice and secure and can't turn around and get access to me. So what's going to happen is we're going to do a quick external examination of the rear end. So when anal glands aren't expressed normally, they can actually become infected and abscess. So we want to make sure that that's not happening here. We want to make sure there's no large swellings on either side. There's no purulent material leaking out. When they abscess, they can actually rupture as well. So we're just making sure that there's not any open wounds before we start doing this. If we see any of those things, we're going to stop. We're going to consult our doctor because it's not in this dog's best interest to have these manually expressed at this point. But she looks great, so we're going to go ahead and get started. The two anal glands are typically located, if you're thinking of a clock face, at the 4 and 8 position. They can be located a little bit higher depending on the dog's anatomy, but typically that's where you're going to start to look for them. So we're going to get some lube on our fingers, a nice generous amount. And I'm going to start with her left. So Evan, are you ready? Mm-hmm. Perfect. So you're just going to insert your finger. So they see that she can kick a little bit, so good restraint is necessary. And I'm going to use my thumb to kind of brace my finger in here, and I'm going to try to locate where this anal gland is. So depending on how large they are, they can be as small as like a small blueberry. They can be as large as like a large grape. So you're going to try and find them, and it's going to feel like a firm, essentially like a grape, like a sack full of liquid. And what I want to do is find the most cranial aspect of this gland. So essentially, I want to start at the beginning and slowly milk that material out, because that opening is going to be right at the opening of her anus, because they're going to filter out that way. So I'm going to use my thumb to brace my finger, and I'm going to reach that front gland and kind of just milk it forward, push it forward. I'm going to hold the gauze up here so I'm not going to splatter it everywhere. This is a good technique to not stand right in front of the dog, and also to keep your mouth closed when you're doing this. Masks are very helpful for this at this point, but it can get pretty messy. So we're just going to casually milk this out. Now this may be mildly discomforting. We're leaving a lot of pressure in here, but you don't want it to be overly painful. So the dog is really reacting, really vocalizing, it seems super painful, we want to stop because that's not a normal reaction. So I'm just, again, using my thumb to brace my finger, pushing forward, and we're actually getting quite a bit of material out of here. Hers were pretty full. We want to make sure that we're squeezing until all of that material has come out. And as sort of gross as this sounds, you want to really examine this material. So we're looking at color, we're looking at consistency, and we're looking at amount. So it's really important that we're assessing this. Typical anal gland fluid is usually anywhere from light brown to dark brown, and it should be pretty liquidy. But it's not uncommon to see it thicken. So as these dogs are not able to express their anal glands, that substance will thicken. So that's pretty normal if we see some thickened. But we don't want to see any blood. We don't want to see any purulent material. Those are signs of a pretty serious infection. So she's clear on that side, so I'm going to start again on the other side. You can use the same hand, but I find it easier to switch hands, especially for Penny. I know that her first one was slightly hard to express, so I just want to make sure that I'm getting a good grip. And we're going to do the same thing, going towards the most cranial aspect of the gland, pushing forward. That one was a very full one. So again, we're getting some pretty thick material, but nothing that I'm overly concerned about with her. And it is important that we are emptying these fully. We don't want to leave any material in there. I'm going to take a little bit of gauze and just kind of clean up the mess that I made. I'm going to take off these gloves because they do have anal gland material on. And then I'm going to clean her up because we expressed both sides. So we're going to clean her up. Just a little spritz, wipe her down. And we should be notating in her record, again, fullness of each size of the gland, the amount of material we got out, consistency, color, and smell. It's really important that we're notating this so we can know what's normal for that dog and be able to look back and see if there's any changes that we're seeing. Because sometimes if we have to do this over and over again, it's going to get more difficult and you'll start to see changes in the material. So it's important that we're documenting that in her file. But that's pretty much it for expressing anal glands on a dog. Thank you, Evan. Thank you, Penny.